Grifols, pioneering transfusion pathways. Grifols has been present in the healthcare field since 1940, creating innovative products and services based on our ethical values and deep-rooted responsibility. Grifols' activities focus on fulfilling the needs of healthcare professionals working in therapeutics, pharmacy, diagnostics, and blood banking. For more than 60 years, Grifols has developed, manufactured, and marketed products of demonstrated efficacy, quality, and safety, contributing to human health, life expectancy, and quality of life. Ever since antiquity, blood has been regarded as a liquid of life, and yet it is only recently that we have developed a scientific understanding of it. Less than a century ago, the therapeutic use of blood was more a question of faith, intuition, and tradition than an empirical discipline. The major revolution in hematology took place in the 20th century, stimulated by the needs of a world at war. Two of the most important discoveries were the identification of blood groups by Karl Landsteiner in 1901 and the discovery of the rhesus factor by Robert Race in 1950, putting an end to fatal reactions due to blood incompatibility. Europe suffered one of its greatest tragedies when the First World War broke out in 1914. There were huge numbers of casualties, and hospitals were soon overflowing with the wounded. Saving lives was the main concern, and blood transfusion became a priority. Transfusions became common practice. They were performed with the donor and recipient side by side, using very large tubes which damaged the veins. And they often failed due to the blood clotting as it was extracted, or because of incompatibility between the donor's and the recipient's blood. The phlebola developed by Dr. Jose Antonio Grifols Roig opened the doors to indirect transfusion in Spain, enabling transfusions to become less traumatic and more reliable. This meant that the donor no longer had to be present at transfusion. It prevented infection, and above all, it made it possible for the blood to be stored temporarily. In Spain, with the outbreak of civil war in 1936, this method became widespread, while at the same time there was a need for supplies of blood behind the lines. As a result, one of the world's first blood banks was created, thanks to the hard work of individuals such as Duran y Jordà, who was internationally renowned as an expert in the storage, transport, and use of donated blood. The U.S. Army gave Harvard biochemist Edwin Kahn the task of finding a substitute for blood, which would be easier to conserve and transport, for use in the treatment of soldiers wounded in battle. Kahn focused on plasma and developed the technique of plasma fractionation to yield a range of plasma proteins. Albumin proved suitable for the treatment of soldiers in a state of shock at the front and was used for the first time during the Second World War. In the years of austerity after the end of the Spanish Civil War, against a background of poverty and deprivation, private initiative was the driving force behind scientific research. Dr. Grifols Roig and his sons faced these challenges head-on, and in 1940 they founded Laboratorios Grifols, a company which soon established itself at the forefront of Spanish hematology. Its contributions included the technique of plasmapheresis, developed by the hematologist Jose Antonio Grifols Lucas. In 1951, Dr. Jose Antonio Grifols presented the plasmapheresis technique to the world for the first time here in Lisbon at the 4th International Blood Transfusion Congress. At Grifols, we are very proud to commemorate the 60th anniversary of his discovery in the same city by presenting the very latest state-of-the-art products in the field of transfusion medicine. Grifols is committed to ensuring safety and quality in transfusion medicine from the moment of donation to transfusion. Today, an integrated system is essential for transfusion medicine practice to provide the highest level of safety in blood transfusion. In the field of blood banking, Grifols has the more complete offer, which includes standard blood bags and leukoreduction systems, fully automated instruments for pre-transfusion compatibility tests, blood typing reagents DG gel and MD multi-card systems, systems for pathogen inactivation of blood components, blood bank software equipment and hemovigilance tools. And following the increasing need for blood group genotyping, Grifols offers Blood Chip ID. When blood typing goes genetic. Blood Chip ID is an IVD test for blood group genotyping based on the identification of the main allelic variants of red blood cell and human platelet antigen. Over the past few years, there have been a significant increase in the number of articles on blood group genotyping that have appeared in major scientific journals. These articles endorse the use of molecular biology in hospital immunohematology units around the world. The call for this type of blood group genotyping test from donation centers and important blood banks throughout the world reflects the need for an accurate diagnostic tool in those cases where conventional serology is inconclusive. When is serology not enough? It is sometimes impossible to locate a commercial reagent for rare minority antigens. On other occasions, those may be too expensive and not very sensitive. The anti-sera do not always react with antigens with low immunogenicity or with those that have low expression. In multiple transfused patients, a greater presence of antibodies may effectively hide the patient's true blood group. When blood is an inadequate source, after frequent or recent transfusions and bone marrow transplants, blood contains donor red blood cells. Since Blood Chip works at DNA level, and the test can be performed on either a blood or a saliva sample. Blood Chip is available in two different technologies. A planar array, Blood Chip reference, supported by a TCAN hybridization station, and a suspension array, Blood Chip ID line, supported by Luminex flow cytometer. Blood Chip reference is a genetic identification panel for determining the most clinically relevant allelic variants for 10 red blood cell and 12 platelet antigens using DNA chip technology. This standard method determines 128 different polymorphisms, including 72 for RHD. The Blood Chip ID line is composed of two groups of panels for the identification of red blood cell and platelet antigens, developed using XMAP Luminex technology. ID Core, identification panel for 23 red blood cell antigens. ID Core Plus, identification panel for 33 red blood cell antigens. ID HPA, identification panel for 12 platelet antigens. Grifols offers immunohematology laboratories an exclusive genotyping service for those samples that require in-depth, extensive molecular analysis to complement pre-transfusion test results. The Blood Chip Service. The genotyping service is carried out by Progenica Biopharma's certified laboratory using various latest generation molecular techniques. In 1998, Grifols launched its own autoanalyzer and started to manufacture this same instrument for other companies. A decade later, Wadiana, in its different outfits, has become the standard. Grifols' ongoing development of diagnostic systems in the field of blood banking has taken us to a brand new dimension. Diagnostics in transfusion medicine are now much safer, more efficient, and easier to trace than ever before. Now, Grifols is proud to present Erythra, the new standard in blood typing instrumentation. Step into the Erythra dimension. This dimension revolves around the number 8, which is the number that offers optimal performance, the highest processing capacity at a speed set by cutting-edge technology. This is a dimension where logic calls for a practical, compact format, where Erythra's upright design fits perfectly in its surroundings with its easy-to-use layout. In this dimension, space and time cleverly unite to offer greater convenience, total peace of mind, and the very highest of safety standards. Erythra is a walk-away, fully automated instrument of high processing capacity for pre-transfusion compatibility tests using DG gel cards. With its self-organizing capacity, Erythra manages and executes all the necessary steps when performing blood typing techniques and investigation of unexpected antibodies. It does the positive identification of samples and reagents. Erythra maintains the globular suspensions of the red blood cells. It dilutes the samples and it dispenses samples and reagents. Erythra incubates and centrifuges DG gel cards. Erythra reads and interprets all the results, and it generates the corresponding reports. Within its category and market, Erythra is introducing an innovative and groundbreaking design feature, the verticality. Erythra organizes the work in a linear order, making maximum use of the instrument's 3D space. As a result, we are able to guarantee that an Erythra is exactly the same width as the current Wadiana, but with 4 times the capacity and speed. Erythra only processes DG gel cards, the ideal combination for the maximum processing capacity, 100 cards an hour, 800 tests. Erythra's capacity and flexibility allows for large autonomy of working hours. It is a real walk-away intelligent instrument that informs of real-time operating status. Erythra allows for the continuous loading without process interruption, double entry spaces, 2 drawers for reagents, 4 drawers for samples, and 4 drawers for cards. Its structure consists of 15 drawers, 2 arms, 2 probes, 4 incubators, and 2 centrifuges. Erythra has the maximum loading capacity, 96 samples, 54 reagents, 400 cards, 16 liters of waste solution, and 16 liters of washing solutions. Welcome to the Erythra Dimension. MD Multicard is an innovative card based on lateral flow technology for the rapid determination of blood groups to assure RBC-compatible transfusions. With one single assay and 1 drop of sample, we obtain the results for 10 parameters. MD Multicard is a straightforward procedure. The manipulation is extremely simple, and it's very easy to interpret the results. In less than 5 minutes, we can obtain the results for 10 blood group antigens. No incubation and centrifugation is required. The method has high sensitivity and specificity, with stable results for at least 72 hours. To confirm the integrity of the test, positive and negative controls are integrated in the card. Grifols, pioneering transfusion pathways.